This is a reference instructional video on how to change the dressing for a radial forearm free flap surgical site. This video is intended for patients and their family to learn how to take care of their forearm free flap site after surgery when they are at home, or even to practice when they are in the hospital with the permission of their surgical team. This video is also meant for medical professionals such as medical students, residents, nurses, or physicians to learn about this specific type of wound care. Also note that specific instructions for wound care may vary per institution. We've made this specific video for Emory, Otolaryngology, and head and neck patients, so we encourage patients to ask their specific providers for exact instructions. To perform dressing changes for the forearm, materials needed include Xeroform dressing or Vaseline dressing. In this case, we have this yellow Xeroform dressing, and this helps keep the skin graft moist to help with the healing. Next, we have web roll, and sometimes Curlex gauze rolls can also be used. These are rolls of gauze that keep the Xeroform in place and provide a barrier before placing the arm splint on. And lastly, we have the arm splint that should be on the patients themselves. To begin, start by wearing some non-sterile gloves and taking off this Velcro strap of the arm splint. There might be different numbers of straps based on the company and the type of splint you are provided. After the Velcro straps are loosened, slowly remove the splint off the arm. At this point, you may start unraveling the web roll or the Curlex off of the arm, and you can slowly peel off the Xeroform or the Vaseline dressing from the skin graft site. Now, to put the dressing back on, we first start off with the Xeroform dressing. You want to put it on the skin graft site and try to fold the edges of the gauze so that only the skin graft is covered. If you have a little bit of overlap with regular skin, that is completely okay. Then you use the web roll gauze to go over the Xeroform site to keep it in place. And with web roll, you can easily cut it off there. If you use Curlex, you may need a scissor to help cut this off. And then lastly, we have the arm splint. Just make sure the orientation of the splint is correct. It may take some practice, and you slowly slide it over, making sure they don't peel off the Xeroform or the Curlex dressing. And go ahead and tighten up the wrist straps and the thumb straps. This concludes the video. I hope that this was helpful. Please reach out to your physician team if you have any questions about your specific wound care.